CT or ultrasound says there's a spot in the kidney. Is it cancer? Is it nothing? How do you know? The widespread use of CT scans is a blessing and a curse. We find a lot of things that really aren't important, but in the old days, 40, 50 years ago, renal cancers showed up when they were massive and people had flank pain, blood in the urine, and you could actually feel an abdominal mass. Many of these were not curable. Now, when we find a renal cancer, it's 2, 3 centimeters usually and is easily curable. So how do we as urologists evaluate this? If a CT scan says there's a simple cyst, just a collection of fluid, nothing to worry about. When we get concerned is when there's a solid lesion that takes up contrast. So contrast implies there is blood flow, which would be more consistent with a renal cell carcinoma or some type of cancer. There are benign solid lesions called oncocytomas. Unfortunately, the imaging people bring to us often isn't sufficient, and ultrasound really isn't going to be good enough. And if a CT is done without contrast, you can't really know if something takes up contrast. So we will often repeat a CT, running you through without contrast and then with contrast to see if the lesion takes up contrast and is consistent with a cancer. Unfortunately, sometimes things aren't black or white. Simple cysts need no follow-up. Obvious solid lesions need treatment, but there are what we call complex cysts, which are in between, and these are a case-by-case basis. Fortunately, because we pick up most of these cancers when they're very small, a partial nephrectomy, just removing the lesion itself and not the kidney, is feasible, and the cure rates are absolutely fantastic.